Good morning, everyone. It is now 11 a.m. And of course, as usual, thank you for joining us for our Zoom presentation today. We're still going to wait a few minutes for other people to join, but I did want to mention and introduce to you Greg Crest and Miranda Broussard, right?
Yep, you got
So
it.
they are going to be our presenters for today, and they are from Chesapeake Bay Aquatic Center. So they're going to talk to you guys about fall prevention and balance and have a couple of resources for you. So like I said, we're going to wait just maybe about a minute or so. Greg, give me the thumbs up when you're ready to go, and you can start talking whenever you're ready.
All right, thank you so much for having us, everybody. Yeah, we'll wait a couple minutes, see if we get a few other participants, and then we'll get the ball rolling. We've got a good bit of information to cover in the time that we have, so just hang tight for a couple minutes, and then we'll get rocking and rolling. Very good. So again, thanks everybody for coming out virtually with us today. We've held these classes before in the past in person, so this will be our first time doing the Zoom class. We just hope everybody leaves today with a better sense of his or her balance issues and can take these exercises that will provide to your daily routine and hopefully help prevent falls, risk of falls in the future. So my name is Greg Crest. I'm a physical therapist. I've been treating here in Baltimore County for about 10 years. I treated in Towson for 5 years prior to starting out here in Reisterstown at Chesapeake Bay Aquatic and Physical Therapy, located in Brick Bodies. I treated a lot of patients with chronic pain issues, with orthopedic issues, and of course balance deficits. Went to school in North Carolina and finished up there in 2011 with my doctorate in physical therapy, and I've really enjoyed working with patients that have balance issues. And so looking forward to getting some info to you guys today.
And I'm Miranda. I'm also a doctor of physical therapy. I have been treating here at Chesapeake Bay Aquatic and Physical Therapy for about 6 months now. I've been a physical therapist for about 2 years. I graduated from University of Maryland in Baltimore in 2019. And definitely really enjoy treating patients with balance deficits, pain, the orthopedic difficulties, especially in the aquatic environment.
Okay, so hopefully everybody can see what we've got up on the screen. Just a basic rundown, just to get everybody into the data out there, the science, the information that's out there right now. Falls are the leading cause of fatal, non-fatal injuries for older adults. From the CDC, some of these statistics that have come out are pretty eye-opening. I included these just so everybody could get a sense of how important this issue is and how we work every day with patients to prevent falls. A quarter of the population of Americans 65 and older has a fall each year. Some of those can be injuries, some of those can be result in non-injuries, but still a pretty large statistic. Every 11 seconds, an older adult is treated in the emergency room for a fall. Again, varying issues with diagnoses and what can happen. They're the most common cause of traumatic brain injuries, TBIs. A lot of physical therapists will work with individuals that have had a traumatic brain injury, and they're a common cause for them. And a real common issue that we talk a lot with patients is, from an orthopedic standpoint, are hip fractures. Many of you may know a family member or a friend who had a fall and had a hip fracture and seen some of the issues that can go along with that and the decline in other health systems and in health status as a result. So we've, like I said, we've been running these classes in the past in the Brick Bodies gym here. Also, we had a course at the Reisterstown Senior Center. I put these two bullets on the page here. One of the things we focused on in one of our classes was getting up from the ground from a fall. It takes some practice, it takes some monitoring. It's something that's I believe is a good idea for a patient to go into a physical therapy office, practice this with a therapist, just so when you're at home and this does happen, from time to time, that you're able to safely get up from that position. a lot of fall prevention starts with looking at what are the causes of a fall. So visual problems is a major issue with this. We have 3 systems in our bodies that lead into what is our balance. We can have visual issues. We have what's called proprioception. That's basically just a term that means you can feel where you are in space. You feel your foot on the ground when you step from carpet to hardwood floor. You can feel that difference and adjust as necessary. The other system is vestibular. So all 3 of those, vestibular is anything dealing with vertigo, your awareness of where you are in space. If any of those systems are compromised, it can lead to a higher risk of falls. Vitamin D deficiency, this is a big one, especially in colder months, and a quarantine can play into this as well. When you're outside you're not outside as much, can lead to degradation, wear down of your bones, which can lead to fractures that often actually happen before the fall, not as a result of the fall as well. Home hazards, Miranda and I talk with patients every day about these kind of things. Throw rugs, tripping hazards, furniture, things around your house that predispose you for an injury around the home. And it's really a 5-10 minute walkthrough that you could do in your house today and really lower the risk factor of falling at home. Strength issues. Again, we have patients coming in today that both in the pool and on land that we'll be working on these sorts of things with is keeping your muscles strong, being able to adapt to a near fall, a slip, a trip. Strength can be a major player in it. Medications, another huge area that we could do a whole other series on, how the side effects. I mean, we've all watched TV shows with that commercials that show you the side effects of your medications that you take. So being aware of what some of those risk factors are is so crucial. And then finally, footwear. I can't tell you, Miranda will attest to this, how many times we have a patient come in for an initial visit wearing flip-flops and complaining of balance issues and stumble through our door before we even get a chance to really talk with him or her. So those kind of issues can all be analyzed and addressed, and it really can lower your chance of falling at home. So, and then finally, and I apologize for this part being a little blurry right here, but really crucial thing that I don't think a lot of patients that come in to work with us know about beforehand are what we call special tests or outcome measures. Now, these are tests that we can do with patients to predict the probability of a fall. There's a variety of them and a lot of research that goes into these. You can think of them almost like a blood pressure check or a cholesterol check, in that kind of regards, where you can get a baseline, make some adjustments, and then improve on these scores, hopefully. There's different tests called Romberg, eyes closed. There's a functional reach test, single leg stance. 5 times sit to stand is a test I often do daily with patients. It's a test to see how your ability to get up out of a chair without using your hands. It's a good assessment of your strength and your balance as well. These numbers I just put on there to show where the norms are. With research and data based on a person's age group, they can find where you should be based on your age comparatively to your peers. Probably the most popular and most researched one that we often do, and in our classes in the past that we've done here at Brick Bodies, we've used the Berg Balance Scale. It's a series of tests that you would go through while monitored by a physical therapist. And at the end of doing these tests, you get a score. And based on that score, if it's less than 45, you're deemed as a falls risk. You would go through a course of treatment or even just do your exercises at home, come back to therapy, and we can reassess, and hopefully that score improves. So it's really important, just to kind of sum up this intro part, is to analyze your environment, your day-to-day life, to prevent these falls from happening, but also get a sense of where you stand comparatively to others in areas that you can improve on. So.
All right, and now I'm going to talk to you guys a little bit about like the fundamentals of balance, what balance is. So to put it simply, balance is the ability to maintain our center of mass over our base of support. We have our little color codes here. So the orange is the center of mass, which you can see on our images below, and the green is our base of support. So pretty much what you're standing on, what's like in touch with the ground. So center of mass is the average position of most of our weight, and base of support is the entire footprint that's touching the ground. So in these images, you can see how it is in like a human. Sometimes a lot of their weight is more up here, or it can be down below where the hips are. So that kind of changes where your balance, how you can maintain your balance. And then we have a picture of like where it would be at in dogs. So most of their weight is obviously in their bodies, but they have the forelegs on the ground. And then the last one over here is a centipede, which they have thousands of legs and a very long center of mass, but also a very long base of support. So then there's different types of balance. So there's static, which is the ability to maintain our center of mass over our base of support while holding a position, like maintaining the same position, so whether it's standing or sitting. And then we go into dynamic balance, which is the ability to maintain our center of mass over base of support while moving from one position to another, whether this is walking, dancing, going from sitting to standing, lying down to sitting. Any kind of movement is considered dynamic balance. And to accomplish this, we can either move our center of mass in space or change the size or placement of our base of support, or both. So there's just little images below here again, just showing you some examples of how our base of support might be moving as in walking. So our center of mass stays pretty still, and we're moving where our base of support is. Whereas in something like dancing, our center of mass might be changing and shifting while our base of support is shifting as well. So we need to kind of maintain that balance of where those two things are aligned in order to prevent falls. So what affects our ability to maintain our center of mass over base of support? And in short, there are a lot of things that affect this. One of the biggest things is our inner ear, actually, which there's a picture of this on the right-hand side. We actually have two inner ears, and they help to transmit signals from our brain, or to our brain, that kind of explain where our body is in space. And if something disrupts this, either like the mechanism of collecting the signals or transmitting and receiving those signals, it can affect our center of mass over base of support, which in turn affects our balance. So like Greg said, there are many things that affect this. So it can be those vestibular issues, which would be an inner ear issue, or it can be things like pain. If you're in pain, you might be changing your base of support or shifting your center of mass, which can kind of cause you to be off balance. Like Greg said, the visual issues, fatigue also plays a role. So that's similar to the explanation of the pain. If you're fatigued and your muscles aren't working as they should, if they're too tired, your base of support might not move as quickly as your center of mass, resulting in a fall forward if you were just walking. Things like nutrition, medications, things like that can all affect where our center of mass over base of support is. Then you also have to consider things like external factors, like the shoes you're wearing, or if a surface changes, if you bump into something, someone bumps into you, that would be a sudden movement of your base of support, which can also impact balance. So there are 3 strategies that help us maintain our center of mass over base of support, which helps us to avoid falling. And there's 3 primary strategies that kind of our body knows how to do already, and they help us promote that functional balance in different situations. So the first one is an ankle strategy. So the muscles that involve your ankle, the biggest ones are the ones on the front of your shin and in your calf. If there's like mild perturbations, like things like small movements, those muscles will engage and help us just prevent our center of mass from moving off of our base of support. So a slight swaying is that ankle strategy coming into effect. We also have a knee strategy, which that's the muscles in our thighs, which is your quadriceps and your hamstrings. and they kind of help your center of mass move lower toward your base of support to help maintain it. So that would be like your knees and hips bending, almost like a mini squat to kind of maintain and bring that center of mass closer to your base of support in order to maintain balance. And then the last one is called a hip strategy, or we also call this one a stepping strategy. So this one's used when you have very large changes in your base of support or center of mass, and you actually have to take a step in order to maintain balance. So your body is essentially moving your base of support to get back underneath of your center of mass, just like in this picture here below. So this first image, this person's falling and their center of mass is moving to the right, so they need to take a step to the right in order to maintain and get that base of support underneath of them.
Okay, so one of the main things we hope everybody takes from today is a specific home exercise program. Now, when we see patients individually every day, we can assess your strength, we can assess things a little bit more fine-tuned, but this gives a really a basic start of what you should be doing balance-wise to help reduce falls. Now, we use this website, and what you can do right now, if you have a pen and paper or just type it on your computer somewhere, is this URL, and it's https chesapeakebay.medbridgego.com. When you type that in, a box will pop up, and you can type in this access code, this 27377ALJ. And what that'll do on your end is pop up these exercises we're about to show you and demonstrate. It'll be fully in color with video and commentary, so you can spend some time on your own going through all this and then begin practicing and incorporating this into your daily routine. So I'm gonna leave this up here for just like 30 seconds if you have to grab something to write it down, but also this information will be available to you on your own after we're finished with our Zoom call here.
Yep, I'm sorry to interject really quickly. I did put it in the chat. They can just email Pikesville SC at Baltimore County MD if they would like a copy of this handout.
Great, thank you so much for doing that. Okay, so then I'll go ahead and scroll down and we're gonna get started. We're gonna shift the camera over here, and Miranda and I are gonna trade off with describing these exercises and also giving you a visual demonstration. There's a lot of factors that can go into these exercises, and a lot of patients will ask how many to do, what position should I be in, where do I do it, how many times a day. So all that information is in here, but the main thing we want to touch on some of the main factors to keep in mind as you're going through these. So there are 9 exercises that we're going to go through, and we'll start with this set. So I'm going to turn the camera over here. Okay, and you guys can see Miranda over there by our treatment table. So the first one, and you know, we like to start out basic and then work our way up. The very first thing you can do with all of these, you will notice that she is performing them at a countertop. So I've told patients in the past to eat, a good option is to go to your dining room table, clear out the chairs, and then you have a kind of a track you can work on, but a countertop works as well. The first thing is as basic as it gets. It's standing on a single leg with unilateral, just means one arm. So you're going to hold the counter with one hand and lift one leg up. Now, Miranda was talking about ankle strategies, knee strategies, hip strategies. This is where you actually, when you first do this, you'll notice where the weak link is in the chain. You may find your ankles wobbling a little bit more. You may find your torsos going side to side. So it's actually a really good assessment tool. Now, I recommend with patients you hold it for about 10 seconds, and I put the numbers on here, and you can alternate. So she would hold it for 10 seconds on one side, switch over to the other leg. And again, I always say the phrase, use as little support from your upper body as you need. You want to be safe with this. It's good to have a chair behind you if you need to take a break. It may look easy on the surface, but these kind of positions can be rather challenging. So a 10 rep, 10-second hold. And you would do this every day. Once a day would be fine for these exercises. The next position is called Tandem. And Tandem just means putting one foot in front of the other. We actually use this as a diagnostic tool for our bird balance test and a couple of our other tests. And Miranda has one foot right in front of the other. It's good to, again, practice, see the switch off. If you've had a history of knee issues or ankle issues, you may find that one position's a little easier than the other. And again, about a 10-second hold 10 times. Keeping your posture nice and upright. You try to stare straight ahead if you can, to take that visual dependency out of the mix as well. And again, she's holding on for safety. She can practice lifting her arm up just for a second and see how long she can hold that. Once she feels the wobbling start to take place, she just places her hand back down. It's as easy as that. And so that's tandem stance, and that's the second exercise you would practice. Again, and this goes into those strategies we were talking about, and actually a bit of strength and muscle power is a standing heel raise with support. So Miranda has her heels coming up off the ground, obviously causing more reliance on the front of her toes and a more balance dependency on that area of her foot. Again, you want to make sure, not experiencing pain or any discomfort when you're doing this, so you can adjust how high you lift your heels up. Just actually as a side note to throw in here while she's doing this, one thing I'll do with patients is change the surface area a little bit. So using a sofa cushion or even a bath towel, folding up a bath towel, putting that under your feet, just something to challenge the body a little bit more if you need it. So a lot of these exercises are really just do them as we let you know first, and then assess your abilities, and then you can kind of doctor them up a little bit and make it a little bit more of a challenge as needed. So that's the first three, and then we're going to switch up, and Miranda's going to show you I'll show you, and Miranda's going to talk through the next three.
All right, so the next one is a squat with counter support. So again, you want to be at a stable surface, hands placed on the countertop. And with this one, you want your feet about hip width apart, just like Greg's, you can see. And you're just going to bend your knees and at the hips like you're going to sit in a chair. Just like Greg's doing. So sticking the butt back first and then bending the knees. So up and down with this one. It's using a lot of leg power, building that strength to help with those strategies that we use to maintain our balance. The next one is a standing march. So again, at a countertop, you can use as little upper body support as needed, and you're just going to bring one knee up and then the other one. So you can alternate with this one. This is working on some strength as well as balance. So you're kind of killing two birds with one stone with this one. Good. The next one is a lunge with counter support. So with this one, you want to hold on to the counter with one hand. Your one foot is going to be in front of the other. Does not have to be a super large stance or space between your legs. And they don't have to be in a direct line. One can be a little bit outside of the other. And you're just going to bend both knees into a lunge. Again, you don't have to go all the way down to the floor. You can just do what's comfortable for you. And this is working on some strength and balance as well, especially in single leg positions. So he's going to show you from the side as well. So both knees are bending. All right, and then we have about three more. We're going to switch again.
Switch off again here. So, okay, so that takes us, should be going down to our, okay, so this one you can really alter as needed. We call it a star drill. It has some other names. And in the picture, or when you watch the video after the program, you'll see that they have some tape lying down on the ground. You don't have to get down on the ground and do all of that. But the idea is that you're tapping in different positions along the ground to purposely throw your balance off with control. So meaning that step as far as you can that's within your capabilities. So as Miranda's demonstrating, she's hitting different positions. You can actually go front, side, back. You can add diagonals in. You can go behind your other foot. You might have to turn, well, you got it. So one of the really important things, and we'll explain, I'm going to explain this with the last one a little bit more, especially when she steps off to the side or behind her other leg. If you think of times where you've had a near fall, you generally recruit these positions really quickly. You step to adjust your center of mass, your balance, your base of support to prevent the fall from happening. So practicing these positions that are natural, little more awkward positions with your foot being behind the other is a really good way of preventing or training yourself to prevent the actual fall from occurring. And actually, that being said, to go off of that, one thing you'll see on these descriptions, a lot of them say take your time, go slow. That's actually really important when you're starting out, so that you're aware of where you are in space, your upright posture, all those necessary variables. But with patients, a lot of times what I'll do is practice these with speed. And again, the reason being is that if you are going to have a fall at home and you're constantly in the mindset of slow down, slow down, slow, 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 and you need to recruit these muscles quickly and adjust this position quickly, you want to actually be ready to do it fast. So again, that's why the encounter is so important, and keeping your balance, safety element while you do these, but speed actually is a good thing to practice while you're doing these as well. So sidestepping is the next one. So now we're going from stationary sort of positions where either one foot or both feet are on the ground, and now we're actually going to be moving. This is, so Miranda's got both hands kind of gently touching the table, and she's sidestepping. She's keeping her toes forward. I'll tell you, 9 times out of 10, if I show a patient an exercise like this, they'll turn their leading foot outwards. Miranda knows too. She's already did it before I finished the sentence. So that is something you want to work on, keeping your alignment straight and do everything with the proper form. She's keeping her knees slightly bent. She's not locking her knees out. And just, this is one where I said the dining room table works really well, because you can set it up like laps. You would go around and say, I do 5 laps of these, or I do 10 laps of these every morning. And so, yeah, sidestepping, we incorporate in therapy sessions, we'll incorporate ankle weights or resistance bands, those sorts of things to address the strengthening issues if they need to be addressed as well. So that's the second to last exercise. And then the last one is, it's called karaoke. We call it Grapevine when we're doing these in the pool. And the idea, again, is sort of like the star drill, is she's throwing off her base of support even more by having one foot over the other. She's weaving back and forth. One foot goes behind, one foot goes in front. She's keeping the same rule of thumb, though, with the toes trying to stay forward. You'll notice if you have some hip restriction or back restriction, you'll start twisting a little bit more side to side. So again, it's more of a awareness of where you are in space and just practicing these. It's a good reason why, whether if you have a personal trainer you work with or a therapist, it gives you another, or a family member at home, it gives you another set of eyes to see what they see from a joint standpoint with those ankle, knee, and hip strategies as well. So really important. And again, all the numbers are on these. You can read the descriptions and watch the videos. And that would be it for that one. So we'll move you guys back to us. Okay, so what we're gonna do next is kind of open it up for questions. We left our information on here, so that's my just email address and phone number if you have questions about our presentation. We also, there's Miranda's as well, so she's at our Lutherville office, and there's her information to get a hold of as well. But we want to hear more from you guys. We're about a little bit over the halfway point. We want to hear some questions if you guys can fire them our way, because it's a great time where you don't have to set up the eval or anything like that. But let us know how you can implement these at home, or if you have any issues of anything we've covered so far.
And feel free to turn your mic on or type in the chat, and we can answer either way.
Get to the chat. Try it. Yeah, that's fine. We can do that. All right, any questions out there? Out there in TV land? And also, if one thing I was going to ask is if anyone had a fall at home recently. We've seen more patients with being quarantined, with spending more time in the house. Actually, a lot of falls around the house itself. Let's see, we got a question. Can a person see you for an evaluation without a doctor? Yes, it's a really good question. So, whether you're going to any office, any physical therapist out there, it depends a lot on the insurance. There's a thing called direct access, and it's a state-to-state sort of thing. Maryland is a direct access state, but it does depend on the insurance. So, for example, Medicare, you do to see a physical therapist, whether it's for knee pain, whether it's for balance issues, whether it's after a knee surgery, a shoulder surgery, whatever it may be, you need a referral from the physician, an order to come to physical therapy. Now that, a lot of patients will ask me, what does that need to say? If it's for balance or anything really, it can say evaluate and treat. It does not have to have a description. It doesn't need to have a lot of documentation to it. Just from an orthopedist, from your GP, a neurologist, any provider, nurse practitioner, urgent care. You would just need a ticket to ride, I call it, and that would be what you would have when you come in for your evaluation, but that would be for Medicare. So any other most other insurances, Blue Cross Blue Shield, the ones that are ahead of their time, I would say, will allow you to come directly to a physical therapist. Usually with your first visit, you would set up a plan of care, we call it. So a lot of that first visit is just getting to know each other, getting to know you, what your deficits are, and then really honing in on a specific strategy for treatment. So that's a really good question. We get that a lot. Anything to add on that?
I think you hit it all.
Another thing too, for aquatics too, you don't need a specific, I've had patients say they need a specific order for water therapy, but you don't need that. But a lot of times what I would say is with these programs when we've done them is you test out this, safely test out this program, implement it into your own day-to-day life. If you notice issues with it, it really can be an eye-opening, a kind of an aha moment if you try one of these exercises and go, I'm having a really difficult time doing this specific thing. Then you can go to find a physical therapist close to you and implement a game plan. So hopefully that answers. If there is any issues with the insurance, you can call up a physical therapy office, and their front office manager, front office staff will be on top of what insurance requirements there are for you specifically. Do you need to belong to brick bodies for? No, good question as well. So, this is getting a little bit away from the balance, but we have a separate sort of agreement with brick bodies that our patients, when they come in, they have access to the pool while they're under the care of the therapist. I've had in the past where patients will come in for treatment and then they will sometimes think they can come in whenever they want, but it is a scheduled appointment sort of thing, but you do not need a gym membership. Now we have had, and there's, full disclosure, there's no conflict of interest with it, but we have had patients when they finish their physical therapy bout with me, they'll join up with brick bodies. Some of that's just the comfort of the environment, getting used to it while they're coming in for therapy sessions. But for balance, it's again case to case. But for different diagnoses, you're in therapy for different periods of time, whether it's a month, whether it's a couple sessions to review a home program. But no, to specifically answer your question, you do not need a membership or need to join afterwards or any kind of requirement with that with aquatic therapy. We do balance programs with the pool. In the pool, I prefer doing a mix with land and water therapy, just because the phrase "we don't live in the water." But the cool thing with balance training in the pool is you can get a little more out of your comfort zone, if you will. The buoyancy of the water is you're not gonna fall while you're in the pool. There are railings in there, and we make sure all the safety measures are there. You can, how do I say, get a little more adventurous with what your exercise plan is, which is, I think, a cool element as well. But good questions, Iris. Thank you.
So, okay, not sure if anyone else has any further questions. This was a great presentation. The demonstrations were absolutely great. I do have a question though. So if you're living home alone and may not have the best gait possible, but what about when you're walking around corners and may stub your toe or something like that? Does that also throw off your gait? I know a lot of people, may bump into their furniture.
Sure. Yeah, the way I kind of analyze it too is there's a lot of things you can't plan for. Miranda and I will go home today and stub our toe against there's a human nature, but the way we look at it is more of minimizing the risks. So I've had patients in the past, if it's turning a corner that they always clip their toe on, or a step, giving some kind of a visual cue, or I'm talking putting a sticky pad up on there, something that that trains your brain to avoid that. It really is case to case, but I think probably the biggest take home message I could get is to go home while you're home today, but spend some time, like 10-15 minutes, and really just look at your living space a little differently, and just kind of say, what if this? We've had so many patients that make subtle adjustments, and it's hard to actually quantify or calculate, did this make a difference? But just making small changes like that. But yeah, it's tricky with corners. It can definitely change your gait pattern, or a issue with your gait pattern could lead to that becoming a reoccurrence. We were talking earlier about turning your toe out. So that's something Miranda and I do with pretty much everybody who comes in for an eval is going to get their gait analyzed. Physical therapists, we always joke that, when we're out in public or sitting on the boardwalk in Ocean City, it's in our blood. We just are watching how people walk. And so catching those things and doing what you can. Some things you can't change with strengthening. If you ever had somebody who maybe had a stroke who wears an AFO, foot drop's a great example of that, where you can wear something external that may avoid future falls. But a lot of it can be altered with just practice, with strengthening certain muscles, loosening up certain muscles that are tight, and really a general awareness of just where you are in space. And that's within a session with a therapist, that's always it's a cool thing to bounce back and forth with each other. And the therapist gives you ideas, you go, oh, I didn't think of it like that. It's a good way to spend the time in a session. And again, it's hard to quantify what the results of that would be, but it does have some play in lowering risk of falls and missteps. I hope that answered. It kind of went a tangential there, but
Oh no, that was perfect. That was great. I know that's a big issue. My grandmother used to stub her toe all the time, and then it started to affect her.
Well,
it did start to affect her gait. So
yeah, it's one thing too to think about is, and again, this is more of the awareness of what is a potential issue and what is an issue, because Miranda would attest for this as well. But I'll have patients come in and they say, well, I don't have any problem getting out of a chair. And I'll say, okay, let's see you stand from the chair without using your hands. And then they look at me like I have 10 heads, and they say, well, I certainly can't do that. And you can look at it like you get from point A to point B, but we like to dig down and say, how are you doing that? So why can't you get out of the chair without using your hands? And a lot of times it's you don't have the leg strength. You're relying on your upper body strength. Walking's no difference. Going up up and down stairs. I've had patients say, of course, I fall all the time up my stairs. Or I don't have any problem going upstairs. I go up sideways, or I sit and scoot up the stairs. So we're all, very good at adapting to how to get from point A to point B, but sometimes it's good to reel it back in and say, how can we make that process a lot easier? And that's what all this is about, really.
I absolutely agree. All right, anyone else have any questions for Greg or Miranda? Nope, just seems like everyone's gait is absolutely perfect. That's wonderful. But in all seriousns, everyone, the handouts that Greg and Miranda showed today will be available. Just email us as usual at pikesvillesc@baltimorecounty.md.gov to receive those handouts. And so I want to thank Greg and Miranda from Chesapeake Bay Aquatics Rehab Center for doing this program with us today. For your first Zoom, this is pretty good, guys. Thank you very much.
Thank you. Yeah, we make sure the technical difficulties were led to a minimum. So, but it's good learning experience for us, and hopefully, like we said, everybody learned a little something they didn't know, and can apply it to their daily life. So we really appreciate you guys having us.
Absolutely, thank you. And the physical demonstrations was really put it over the edge. So thank you very much. All right, everyone, thank you so much for joining us. If you have any questions, again, you want to receive the handouts, please email us. And we will see you tomorrow for a Cup of Joe with Johnny O, 8:30 a.m. Thank you very much. Enjoy the rest of your day, everyone.